In the headlines lately,
COVID breakthrough infections.
We're increasingly hearing about fully vaccinated people infected with COVID, from athletes and politicians to everyday Americans.
And then when I tested positive, I was like, what is going on?
Over the weekend, singer Doja Cat, who says she was fully vaccinated, testing positive for COVID-19. In a tweet, she says she'll no longer be able to perform at her upcoming tours, but that she's doing okay and looks forward to recovering and getting back out there. So what is breakthrough COVID? It's when a person tests positive at least 2 weeks after being fully vaccinated, sometimes with no symptoms, and other times feeling classic COVID symptoms, loss of smell and taste, fever, aches, and cough. The CDC tracks breakthrough cases by following healthcare workers, frontline workers, and data from state health departments.
That's giving us a really accurate view of breakthrough cases, both for 2 doses of vaccine and now for booster shots as well.
A Washington state study of 4 million fully vaccinated people shows about 1 in 5,000 experienced a breakthrough case from mid-January through mid-August. The most recent CDC data shows that in September, unvaccinated people had a nearly 6 times greater rate of testing positive for COVID compared to fully vaccinated people, and a 14 times greater risk of death. More than 200 million Americans are fully vaccinated. That's 60.7% of the eligible population here in the U.S. According to the CDC, COVID vaccines are keeping people out of the hospital. These symptoms from a recent breakthrough case.
I started out with a head cold. I thought that it was just allergies.
Fever, chills, fatigue. I had a terrible headache.
So, I mean, that really raises a lot of questions. We have Dr. John here as well. And first of all, just perspective, because how common are these breakthrough cases?
You know, they're a lot less common than most people think they are, because you hear about them, but they're not happening that often. They're more common than we thought they would be, because we thought the vaccine would give us more protection, but then Delta came along. And so we're seeing them more often. But like Vicky mentioned in her piece there, you're 6 times more likely to test positive if you're unvaccinated. And that's where we're seeing numbers overall.
What if you're vaccinated and boosted? Are there people who are getting those breakthrough cases who have gotten the 3 shots?
We think there are people that have gotten 3 shots and are getting breakthrough cases as well. The thing about that, though, is they're less likely to get hospitalized. They're much, much less likely to get serious disease, and their symptoms seem to be milder. We know their viral load goes up, but then it goes away very quickly compared to those that are unvaccinated especially, and they tend to get over it more. People talk about their symptoms. They say they're much lighter, only last a couple days, and they bounce right back.
And then if you've been around someone who then tests positive, should you get tested even if you're vaccinated? I mean, how do you know when to take a test?
And what the CDC's criteria are, if you're in close contact, meaning if you're within 6 feet for 15 minutes or more, then you should get tested. If you start getting symptoms, regardless if you've been around somebody, you should still get tested at that point. And then start thinking about your own factors. If you have high-risk people in your house, then you might want to get tested. If you're going to parties, you might want to get tested.
Yeah, Vicky, what do we know about the people who are getting these breakthrough cases? Is there kind of like a profile?
Well, we know that everybody has an individual risk profile, and it includes a lot of different factors, Hoda. 1, how healthy are you overall? 2, what's the community rate of an infection in your area? 3, what are you coming into contact with? Do you have a public-facing job? Are you working from home? Who are you spending a lot of time with? What we also do know is vaccines are highly effective. The newest data coming out of the LA County Public Health Department, for example, shows unvaccinated people are 29 times more likely to end up in the hospital than someone who is vaccinated if they get COVID.
So vaccination would be the top of the list of things to do to lower your risk. Exactly. What other ideas are there?
Certainly this time of year, it's tempting to go inside. It's cold, but try to avoid those crowded indoor spaces with strangers. If you have to be inside, wear a mask. Consider getting a booster if you haven't. That's going to give you optimal protection. And then going back to the basics of washing your hands, eating a balanced diet, and getting sleep. I know that's easier said than done, but 7 to 8 hours of quality sleep. Consider getting a flu shot, too. These are all things that help optimize your health and boost your immune system.
7 to 8 hours of sleep. Okay. Writing that one down. Okay.
All right.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.